Information this week, didn't they?
Absolutely.
CDC? As we count down now on the healthcare overhaul in the House, we're hearing, well, we could be just 48 hours away from a possible vote on the floor of the House. At the same time, we're getting new details on a new Republican plan, a plan that reportedly offers lower premium costs and also covers fewer people. Ranking member of the House Budget Committee, Paul Ryan, Republican congressman out of Wisconsin, back with us here. And Paul, good morning to you, sir. Thank you for your
good morning,
time.
Bill.
I know you want to slow the growth and control the spending. How so? How could you do it?
Well, first of all, we're not proposing our own version of a 2,000-page takeover of the American healthcare system. We're saying let's do a series of reforms to bring costs down and make accessibility more for Americans. A couple of things. End junk lawsuits in healthcare. Let people buy their health insurance, small businesses and individuals, in large nationwide buying pools that get volume discounts. Establish high-risk pools in every single state so that people with pre-existing conditions can get affordable care and they don't get priced out of the market. Lots of reforms like this are what we're talking about to bring down the cost of health care and make it more affordable and accessible for everybody.
Some of that is getting traction, like the pre-existing conditions. Seems to be some common ground on both sides. But the other things you mentioned, they're not in this bill.
Well, interstate shopping.
And if you don't move quickly, they won't be a part of it, will they?
Well, we also are proposing interstate shopping, allow people to buy health insurance across state lines. There's a series of reforms we're proposing that the Democrats aren't proposing because you know what we want to do? We want to bring down the cost of private health insurance to make it easier for people to get it. Under the Democratic bill, according to the Congressional Budget Office and every other expert that's looked at it, they're making private health insurance go up. In my state of Wisconsin, the Blue Cross Blue Shield plan says people in their 20s are going to see a 199% increase in their health insurance premiums. People in their 40s, like you and I, 122% increase in our health insurance premiums with their private health insurance under the Democratic alternative bill. So what we're seeing here is a government takeover that's going to make private health insurance much more expensive and push people into this government-run plan. And we don't want to have any business with that.
And Democrats have taken a look at your idea already. They say you do not reduce the number of uninsured in America.
Well,
how could you tackle that? Is that a fair criticism?
I think there are many things we could do and add to this. This is a consensus bill, but by bringing the cost of health insurance down, you make it more available for people. And so we are bringing the cost of health insurance down demonstrably, and we believe that that's going to make it easier for the uninsured to get insured.
Now, give Democrats the benefit of the doubt. What's the best case scenario you see if the House bill that's on the table right now passes over the weekend? Say it becomes law. What's the best case scenario for America?
This is a terrible piece of legislation, Bill. This is the biggest government program Congress will have created since 1965. This will, in my mind, and no doubt, give us massive deficits in debt and lead to a government takeover of our health care system. So I don't even want to put the word best in the same sentence with this health care bill. If this passes on Saturday, which is the plan, then it goes over to the Senate and we'll see what happens over there. I think the Senate and the procedures are going to tie things up. I personally think this bill is going to move into next year. So let's see what it looks like next year if we can get this thing drawn in next year.
I think you're right about the schedule, pending on what we've heard from Harry Reid on the Senate side. You know, one of the big provisions here in the Democratic proposal is to really slash Medicare spending. $500 billion worth. Now, if you look at the results from New Jersey and Virginia the other night, are any lawmakers, be it Republican or Democrat, ready to go there and cut down seniors at a time when the voters have spoken?
That's right.
They're worried about spending in the economy. Go for it.
Independents left the Democrats in droves, and seniors left the Democrats in droves in New Jersey and Virginia. What Medicare is now telling us, if this bill passes, they're telling us 64% of all the seniors on Medicare Advantage, that's about 20% of seniors, 64% of all the seniors on Medicare Advantage are going to lose this plan under this bill. That's what Medicare is telling us. So we know that we're going to see something like 8 to 10 million seniors lose the Medicare they have right now that they enjoy under this legislation, according to Medicare. So this is why we're saying, look, hold this thing off. Don't pass this. But unfortunately, the Speaker Pelosi is trying to jam her bill through as fast as possible. Harry Reid's trying to come up with every parliamentary procedure he can come up with to move this thing through before Christmas. I personally think we can delay that and get it in next year, and then we'll see.
But my point is, are politicians willing to go there at the expense of their own job now?
Yeah. Look, Bill, I think what's behind this is basically ideology. We could have a huge bipartisan success in reforms that we know and agree with each other on how to bring down the cost of private health insurance and make it more affordable and accessible for most Americans. That is not what they're trying to accomplish here. What is trying to be accomplished here is to have the government take over the healthcare sector. move us toward a system where the government does run health care in America. That is more about ideology than it is about health care policy.
Paul, thank you for coming today. Paul Rand, Republican of Wisconsin. We'll talk to a Democrat next hour, Anthony Weiner, a Democrat from the state of New York, and also waiting for that moment on Capitol Hill today when